hear me breathing in this, so. Is it happening? Okay, we're going to get started. Yeah, now be quiet. Oh no. Okay. I'll try not to break this. And I apologize. I woke up with a sore throat, so if I have to take a water break, I'll try not to glug into the microphone. For those of you, there's lots of familiar faces because this is what our fourth year doing this. Those of you that don't know me, my name is Dr. Vicki Johnson. I'm a veterinarian over at Cleveland Equine. Clinic's about 10 minutes from here in Ravenna. And we service pretty much all over Northeast Ohio. So every year, Belinda and I, when we're planning this, we say, what do the people want to hear about? And, oh, don't laugh into the mic. Okay. We always are talking about things, and we've come up with some, I hope, interesting topics in the past. But one of the things I said this year was, looping a lot of this together and talking about senior horses. I feel like, we really don't think necessarily about senior horses as an entity, but in humans, there's an entire specialty for geriatric medicine. Like that is all certain doctors will do is take care of the elderly population. And we don't do that in horses. So now I have owned horses my entire life. I'll tell you, I'm 32 years old. So 30 years ago in the 90s, which I'm sure for some of you is not that long ago. For me, an old horse was like 18. Everyone agree? Yeah. What do you guys consider an old horse now? Yeah, 40s, 30s. Isn't that crazy? A 40-year-old horse? How many of you know a 40-year-old horse or in their 30s? Yeah, isn't that nuts? I don't think we give the horses enough credit because truly, even just 20, 30 years ago, those horses were like, you maybe drove past one in a pasture somewhere and you're like, whoa. Now that's like, I have some 25-year-old horses that are still doing Grand Prix dressage. And the owners are like, we're going to go 10 more years. I'm like, you go, girl. I'm here for you. Or guy that rides dressage. So I think that that's, something that when I was thinking about this topic, it's actually pretty easy to make a presentation on this because this is what I do all day long. I would say the majority of horses I see now and spend time with are old horses. We were just talking about this in the clinic on Friday because I did a castration. And I was like, man, I don't get to castrate things anymore because we don't see young horses. So if you guys could work on making more, that'd be great. So I'm going to go over kind of a range of topics. And I have to walk across to click my slide. So hopefully I'm not in anyone's way. But what I've done is I've kind of made us a little tour guide here. So we're going to go through a couple things. In the beginning, I want to talk a little bit about what is an aging horse and how do we define that both medically, and then I'll take my veterinary hat off on and put my just horse person hat on. And then I'll go through a couple of different specific things. So common kind of woes of aging horses. I have a whole section on endocrine diseases, because if any of you here have older horses, I'm sure you know all about endocrine diseases. And then we'll talk a little bit about nutrition. And then I'm going to go over just kind of some of Doc Johnson's tips and tricks for helping maintain an older horse. Because again, this is literally the majority of what I do. So we'll start with the aging equine. So, like I said, in the past 50 years, this has changed. When I was researching for this presentation, there's really no good metric for measuring horse age in the United States. No one's like surveying people, which I think is kind of sad because I think it'd be interesting to have some more concrete data on this. But what I could find is that essentially since the 70s and 80s, the average age of a horse has increased by almost 10 to 15 years. And more specifically, the AVMA has actually surveyed horse owners and said, what do you consider to be an old horse? And in 2002, old was 22. And owners said, I start to see aging changes at 23. How many of you here have a horse that's 22 or older? How many of you that have those horses are still doing things with them? Yeah, that's almost all the same hands. Those horses now, I feel like even if we're saying, oh, they've got some gray hairs around their muzzle, we don't care. Those horses can still have productive lives and still do things. And I think changing our frame shift of what is a productive horse and an active horse has really been what's kept these horses around longer. It's no secret we're better at taking care of them, right? I only have 3 feed bags behind me. Guess what? There's 333 feed bags back there that you can choose from to feed your horse. You're taking better care of their teeth. We're vaccinating them. Preventable diseases, we're taking care of those. Osteoarthritis, degenerative joint disease, we're caring for those horses so much better. But also, when I was a kid, it was not uncommon. I used to clean stalls at the standardbred track. That was my job. That's how I got humbled as a teenager. And some of those horses, if they'd break down at 7, they just got euthanized. They were done. They couldn't serve their purpose. That was it. Now, there's like 33 14-year-old girls that are like, I'll take it, they can come live with me and I'll just let it have a second job. And so we're repurposing horses in a way that supports their longevity. All of the associations, the retired race horses, anything, even some of you that have sport horses that maybe can't jump anymore, those horses are going on to be fabulous flat horses. And so I think that just the fact that we have kind of changed our frame shift of how long a horse can be productive, and then also how well we can take care of them, has really contributed to the aging horse. So some of the biggest changes that we see in horses that I and you get to deal with. Number one, I think, is soundness and condition. And we're going to talk about this a little bit, all of these things a little bit more in depth, but this is kind of my little overview. So obviously soundness, we know that the things that afflict horses are usually degenerative, meaning they get worse with time. And so how can we manage those things as the horses get older, and what tools do we have available to help keep those horses comfortable? We have a couple, some more new than others. And then condition. It's no secret that some of our senior horses struggle to keep weight on. And no one likes to think about sitting on our poor 26-year-old horse whose gravity is maybe taking a toll on, the back's getting a little lower. Those horses, that can obviously impact their usefulness just from a simple pragmatic approach of, hey, I don't want to get on that horse anymore. Dentistry. If you were here last year, you got to hear my entire 1 hour and 15 minutes soapbox on dentistry. So I'll talk a little bit about that today, but I've tried not to continue to bore you with the topic of teeth. But horses, as they get older, and I'll talk a little bit about this more in depth, their teeth don't stay the same through their entire life. You and I are very unique creatures to the world. When our adult teeth come in, what you see is what you get. You got a crown that's in your mouth, a root that's up in your skull. That's it. Don't break it, because you don't get more. In horses, they have crown that's in their mouth, they have reserve crown that's up in their skull, and then they have the roots. So constantly over their lifetime, they're erupting a little tooth and wearing some away. And so the tooth that I see in a horse's mouth this year is not going to be the same tooth I see next year. But eventually, they get to the end of that tooth, and then there's nothing left that's there that can grind for that horse. In the wild, those horses get skinny and pass away because they can't grind their forage and grind their food up to be digestible. Nowadays, we just give them 20 pounds a senior, and they live for another 30 years. So we can change those things. Physiology, okay? We've all heard the saying, getting old is a insert expletive here. Thank you for the whispers. It's the same in horses. Things don't work as well as they used to. Horses, as they age, their connective tissue loses quality. They lose the ability to heal things as efficiently. Their GI tract doesn't function as well as it once did. That is true for every mammal on the planet. So unfortunately, we get some of those things that are just kind of woes of aging that there's really not much we can do about it except for try to support those horses through some of those changes. Obviously, part of that physiology too is our endocrine diseases, which we'll talk about some more. And then things that we consider diseases of old age. So when we look at all the things that can happen to horses, there are multiple of those things that have a higher incidence of horses that are older. So things like choke, there's certain types of colic, infections, those are statistically more likely to happen when the horses are older. So some of those things, again, we just have to kind of deal with as we get to them. So soundness and condition. I have this picture on the right. This was a horse I saw for a lameness evaluation. He's like a 17 or 18-year-old paint horse. And they said, well, he's always been kind of short behind, and it's just kind of gotten worse. We x-rayed his poor hock, and I was like, I don't think there's a normal joint in there. And so as this horse has continued to get older, it's something that they have a little less tolerance for these things. And you'll hear me say the word tolerance a lot because older horses just don't have the tolerance of younger horses. And I think that's part of where some of our care strategies come in. But unfortunately for us, most of these conditions, osteoarthritis, degenerative joint disease, kind of all the same term, right? Degenerative. They get worse over time. When you have, I think some of us kind of forget when we say, oh, that horse has some hock arthritis. Okay, hock arthritis is pretty straightforward. The joint does not joint. Unfortunately, those joints and lower hocks, which is what this horse has hock arthritis of, those joints are really just they're adaptive joints. So as that horse loads the foot and goes to step off, those joints are rotating and taking the load. Some joints like ankles, knees, those joints are big range of motion joints. So every time that horse steps, they have to lift and load that leg. And those joints have much less tolerance for changes. And it's not just, there's some inflammation there. I mean, these are mechanical changes. The joint can no longer move and load as it's supposed to. Who in here has artificial joints? Anybody? Oh yeah. You're like, I didn't want to admit it. Thanks for calling me out. Sorry. Um, in humans, I make this kind of joke sometimes with horse owners. I'm like, hey, if this was our human, we'd cut it off and put a new one in there. In horses, we have not yet gotten to that level of surgical finesse, if you will. And I don't know that they would tolerate it, to be honest with you. But these horses, unfortunately, we as veterinarians reach a point where all of the management strategies, and in 2026, I have so many tools to deal with degenerative joint disease and osteoarthritis, but at some point, those tools are going to be less effective. And unfortunately, if we reach a state where the joint is just no longer physiologically capable of doing its job, you could throw holy water in there and it's not going to make the horse sound. So then how do we manage those horses appropriately is a big struggle. And then obviously, when you talk about condition, body condition, when we were chatting up here in the beginning, not all seniors are hard keepers, but it's certainly something that we have all struggled with at some point in our life in managing those horses and keeping their condition appropriate. So both their dentition and their metabolism can affect how well they hold weight. So here we go. Back to the dental grind. So I found this picture, and it's a little crude, but I think it really demonstrates this if you're not familiar with horses' dental anatomy. This is a skull that's had kind of the outer bone taken away, and you can really see in this picture, and this is a young horse, so you can really see how much teeth they have that you never see unless you x-ray their head. So we have this portion that's actually in their mouth called the oral crown, and that amount of tooth is only about 1 to 1.5 inches of crown that's in that horse's mouth. Then they have all of this crown up in their jaw called the reserve crown, and then the roots are at the very tip. So horses and most other herbivores, so a friend of mine went to Africa recently and brought me back a tooth. And he said, I bet you can't tell where this came from. And I was like, it's something that eats plants. Because it looked just like a horse tooth. Like literally, I could have put money that it was horse. It was a giraffe tooth. It is the same shape, the same size, the same general characteristics. So I think that's really interesting. And, we can talk about evolution all day long, but, these creatures that are meant to take in fibrous feed material and grind it into something smaller and then get it back to their digestive tract, they have highly efficient teeth and jaw muscles and chewing muscles. Horses chew in a figure 8 pattern, so a little bit up to down, a little bit left to right. And so they have to take all that fibrous plant material and break it down. When these guys get to the end of that reserve crown, it literally turns in, well, I'll pause on that for a second. I have put in here because I recognize that as someone that stares in horse mouths for most of my life, it's very easy for me to be like, yes, abnormal. And for those of you who don't look in horse mouths, you may be like, that's a tooth. So this is a picture that I took of a young horse, what I would consider normal dentistry. Now we'll ignore the hook up here that I shaved off momentarily after I took this picture. But can you see the nice undulating pattern of these crowns in this horse's mouth? That is normal. We don't float that off. I've had people that stand behind me when I do dentistry. They're like, it's still wavy. I'm like, yeah, if I float that off, your horse will have chiclets and you'll be feeding him mush. So that is very normal dental anatomy. And you can see that there you have about 1 inch of crown that's in this horse's mouth, and that's what they grind with. When these guys get older, that changes pretty significantly. And this is not, of all the old horses I float, I tried to find a good picture and I didn't have one. So this is mild. When I'm talking about geriatric changes, this is like, if I open this mouth, I'm like, oh, I can work with this all day. But even in this very front tooth, you can see here, we've got this big kind of cavitation that's happened on the middle of that tooth. And then his friend, his dancing partner down at the bottom, has grown quite tall. And I apologize to people in the back. I see you all craning. We're going to put the slides online so you can take a peek at it. There you go, end the video. So in geriatric horses, when they get to the end of that reserve crown, truly, we use the term cupping because that's actually what happens as they turn into a cup. And if you imagine 2 cups, there's not much touching in between. So when that horse takes food into their mouth and they try to chew that, I always joke that it's like Nana without her dentures in. There's not much happening there in terms of grinding that horse can appropriately digest that. Cows ferment feed in their stomachs. Horses only have 1 stomach, so it's not a good fermenting vat, but their colon is where they ferment their feed. In a horse's colon, does anyone know how long a horse's colon is if you stretched it out end to end?
6 feet? Mile?
Yeah, a mile. It feels like a mile when it's got problems, right? Yeah. It's about 20 to 30 feet. So it's this big, I used to work at a surgical practice. They're about yay big around. And it's literally just a giant fermentation vat. They are so efficient at fermenting. You all have appendixes, right? You know what your appendix is? It's this problematic little finger-like thing that sticks off the edge of your colon that if you make it angry, you have to go get surgery and take it out. Horses have an appendix. We call it their cecum, and it's about yay long and yay big around. And that's literally where they start the majority of their fermentation. They have a host of little friends that live in their colon and their cecum that take that fibrous material and break it down to produce volatile fatty acids, a lot of the amino acids that horses can't digest or primarily make for themselves, vitamins and minerals. So I tell people, we think teeth are this like simple thing. We just got to float the points off. But that is the first step of a horse's digestion, and that's so important. Because if that feed is not entering their colon at an appropriate size, they get nothing from it. Because they're not like you and I, that it just has to get to my small intestine and absorb things. They have to ferment it. And so if any of you have ever dealt with fecal water syndrome, another hot topic, you know just how bad it can get when their colon does not ferment things appropriately. Sorry, I laughed into it again. You get to wash it out of their tails approximately every 48 hours. So this is truly, and I think we kind of like make light of how simple dentistry is, but it's so important because it's the first step. They really can't grind well when they're bad at their job. So this is kind of a hot topic, floating an aging horse. You know, there's so much that goes into a good float. And I tell people all the time, I can teach all of you here how to float teeth. It is not technically difficult. But for me, the more important part is that examination. So has anyone here had their dentals done with me? Anyone? A couple. I got a couple hands. So a couple of you have senior horses, I know, because I've worked on them. But like when I do what I call my bread and butter senior horse dental, the dental is like this much of the appointment, and then just talking is about this much of the appointment. As I'm sure you've gleaned at this point, I can talk for a long time about things I enjoy. Uh-oh. No, we're not interested in updating. Thank you for asking. Okay. So when I get into an older horse's mouth and maybe their teeth aren't in the best condition, there's a couple things that go into that. So number one is the horse, and we'll blame the horse for most of this. Some of them don't have great oral anatomy. They don't have normal amounts of teeth. Their teeth aren't in the correct location. Maybe their teeth were not formed correctly. Horses have very unique, and I really don't go into this because it would really put most of you to sleep, but they have very unique teeth. They're not you and I, our teeth, all you see is the enamel. Horses actually have layers of their tooth, like an onion, where there's different sections of different type of dental material. And so those, if they're not formed correctly as the horse is developing, then you'll get some changes that happen in the tooth later in that horse's life. And so there are only certain things that I can manage, and not only can, but safely can. Because if you go in and you try to just change the whole horse's mouth, the worst appointments I've ever had are after, and I'm not trying to fire shots here, but I've gone to see horses after another person has worked on their mouth, and they're like, well, my horse was, doing okay. We got our annual float. Now they're dropping feed and they're dropping hay, and I open the mouth and everything's just been flattened. And now the horse looks like a textbook, but for that senior horse that didn't have much crown to work with, you've taken all of their teeth out of contact and now they can't chew. So there's only so much that we as dental practitioners can safely do to modify that mouth once the ship has proverbially sailed and we don't have a lot of crown to work with. So that's why we get on our preachy high horse about annual dentals as the horses are younger, because if I can keep the mouth balanced and sometimes, again, if the horse is not normal, work with what we've got, then a lot of times I can account for that as the horse ages and keep their mouth in the best condition I can. Sometimes we don't get that lucky. I work with a couple of rescues and the horses have never had their teeth floated, and I open their mouth and I say, hey, I'm going to do what I can, but we're going to have to do massive dietary changes here because this horse will never be able to eat normally because, it should have had care eons ago. And so it's just what we've got. One of the biggest things and why I preach this sedated oral exam with a speculum is one of the things we have as a field of people that practice dentistry. We've gotten a lot better at identifying. It's not just points. Points are the easy part. Again, I could teach all of you to float points. That's simple. Burr, tooth, boom, done. For most of these horses, one of the bigger woes they actually deal with is periodontal disease. How many of you have ever had gingivitis? Okay, no one wants to admit that. They're like, I brush. Okay, no gingivitis here. Okay, gingivitis, or essentially inflammation in your gums, is excruciatingly painful. Like, people don't think about this. The connective tissue that keeps your teeth in your mouth are very sensitive, because your mouth, again, none of you, maybe as you're eating your hot dog later, you'll think about prehension, but your mouth is constantly taking on tons of information at once. What am I eating? How chewed is it? What's the temperature? Where's it going? How am I doing this? Horses are the same way. So one of the things that we deal with is when these guys, especially as their teeth change and they're shorter, they can drift apart. They can kind of go out of their normal place, and they'll pack feed down in between their teeth and actually create a lot of dental issues, and changing the way their mouth, even just chews, because they're trying to avoid pain. That can mess up their teeth just in itself. So this is where, when we do our oral exams, myself and the other practitioners at our clinic that do dentistry, we're very passionate about using the mirror and examining all sides of the teeth, because if we can identify a periodontal disease, we can treat it. But if you don't treat it, it can lead to a whole host of problems, especially in the upper teeth. The back 3 teeth, horses have 6 cheek teeth in every arcade. The back 3 teeth, the roots of those teeth are associated with the floor of the sinus. So that's why, if you've ever heard snotty nose might be a tooth, that's why. So if these horses, those teeth start drifting apart and they're packing feed up in there, what likes to live in feed? Bacteria. And so then what happens is that bacteria travels right up the tooth like a little highway and goes right in the sinus, and then boom, horse has a snotty nose. And that's not because necessarily of the tooth itself, but it's a periodontal disease. So we can treat a lot of that stuff. So I always tell people, if you have one of us at the clinic do your horse's dental, we always tell you, like, hey, this can be a yearly thing or every 6 months. It kind of depends on the horse. I'll tell you a story about this poor creature. I got called for an appointment, and the appointment just said, like, losing weight. And again, I'm like, yes, senior horse losing weight. This is my Daytona 500. So I get in there and I'm saying to these people, I'm like, hey, what's the story? What are you feeding the horse? When was the horse's last dental? Kind of getting the history. Oh, we don't know when the horse's last dental was. We feed it, I don't know, insert 12% performance grain here. It's just not gaining weight. Okay, cool. Let's start with the teeth. Always makes you look like a superstar when you get the right thing first, right? So open up the horse's mouth. Okay, it's a mess. We've got all these teeth and again, right now I'm just looking, ignore this picture, because right now I'm just looking at the crowns, right? What's in the mouth. We've got lots of hooks, we've got lots of points, we've got overwear, underwear, we've got, not underwear, but you get it. There's underwear in there, you have bigger problems. There's lots of, we use the doctor term is malocclusion. Occlusion meaning how the teeth touch and connect. Mal means bad, right? If you took Latin, you get that. So off the bat, I'm like, this horse has a horrible malocclusion. I can correct some of this. So I get my trusty little float out and I put it on the horse's first tooth and I press my little motor. Guess what? All the teeth start wiggling. And I was like, oh no, my worst nightmare. So if you've ever had a tooth extracted, not yourself personally, but a horse, for me to extract a normal molar takes anywhere from 3 to 5 hours by the time you block them and elevate the tooth and then remove the tooth. Taking all 8 of these molars out took me 15 minutes. Because once I took one out, all of its friends were like, finally, we're free. And they just fell out. Like, I don't even think I took a tool out. I think I used my hand and just plucked them. These teeth were so afflicted with periodontal disease. And again, to me, this picture is shocking because of how abnormal it is. To you, you can certainly see ugly teeth on a blue towel, but like these roots that just look like little rounded, those are not normal. They should be nice pointy roots with little ends that are connecting. These teeth have been dead for a long time, and essentially they were just all holding each other in. They were just kind of like group therapying. So as I took one out, they just all were like, goodbye, and out they went. I took some really fun pictures of these. You can see that tooth on the left. I think the closer you look at it, the more shocking it gets. There's feed packed in the decay. And if you think about it, right, this part where the staining is what was in the horse's mouth. That's the oral crown. So this was up in the horse's skull. So if you imagine that feed weaseling its way up the sides of what we call the interdental space, or essentially the space between the teeth, this horse has been packing feed for a long time, and that tooth has just rotted away. And so same thing on the right there, all that white stuff is calculus or tartar. So the horses eat a diet that's high in minerals. All that mineral just collects there. It's like a little horse pearl. So these teeth were clearly very diseased. And so you kind of feel bad when you get in these appointments, because here I am just like pulling teeth out of this horse's mouth, and the owner's standing there like, I'm like, I'm sorry. Like, there's no other options. You can't save these. In fact, they need to come out. It's just causing the horse problems. But the good news is, when I got done, you're like, hey, I have great news for you. This is gonna be so easy. The horse just needs to be on Mush Senior. That horse, these pictures I think I took in 2024. The horse is doing great because we just modified its diet. It's eating chopped hay and Senior, and she is fat, happy, and living her best. They're riding her. I'm like, this is all you have to do is change your diet. It's really, again, and those of you who have Senior horses that you're feeding intensively, you're like, yeah, you're standing up there saying change the diet. We'll talk about that more in just a second because it's not that easy. Another quick plug for dental disease in horses: EOTRH, equine odontoclastic tooth resorption and hypercementosis. I know everyone's like, geez, that's why we say EOTRH. We're not that smart all the time. So this disease is a disease that affects the incisor. So I put an x-ray up there. Again, perhaps if you don't look at a lot of dental x-rays, you cannot appreciate how ugly this is. But all of this is very reactive, inflamed bone. And then these incisor roots should not be this large and circular. And the teeth obviously should not have these giant holes in them. And then you can see this horse like fractured off its canine. It's missing a tip of this tooth. So this is one of those diseases that are commonly more associated with older horses. We don't know why the horses do this. It essentially is like an autoimmune disease where the body attacks the roots. And so the resorption means that the tooth gets eaten away. The hypercementosis is where you get these big balls of cementum on the bottom of the root. Unfortunately, when the horses get severe enough, the only treatment for this is to pull all the teeth, which is very shocking for most people. And I always tell people, like, what I'm about to tell you is going to scare you off. But I have a list of about 10 people that you can call, and they will tell you when they get to this phase, this horse had all of his incisors removed, they are different horses. This condition is very painful. And we as horse people, so vet hat off, horse person hat on, are very bad at identifying oral pain in horses. And horses are very good at hiding it because they're prey animals. But I've had people tell me, and they're like, listen, if you ever need to convince someone to do this surgery, call me, because my horse post-operatively was a new horse. They're like, I didn't realize how much their personality had changed probably from the oral pain until the teeth got pulled, and they just kind of make a 180. So some horses we will manage if they're not that painful. Like, we can identify some things externally, like when I'm doing a regular dental, I'll say, hey, I think your horse has some EOTRH, let's take x-rays. Sometimes you can manage them, but if they get to a point where they're very painful, they get evicted. And it is shocking, but the horses, we send them home the same day eating normal food. They don't even really miss their incisors, to be honest. So last little bit on physiologic changes. Their body function changes with age. I love this picture. I just want to cuddle this little mini. Yeah, I know. He came in for Dr. Wrangle to extract a molar on from his old age woes. But because Dr. Wrangle, if any of you have met her, she's very short. And this mini was very short. But it is not fun, like rolling around on the floor trying to extract a tooth for 3 hours. So this is what we functioned, was we made him a little stand on our surgery pads so he was taller. But anyway, so some quick things on this. Again, collagen, we know that as horses age, collagen decreases in quality. So horses that are older, especially if they have Cushing's disease, are more likely to develop soft tissue injuries. And then certain tumors like melanomas, lipomas, fibromas, they're usually not like malignant things, but just local kind of connective tissue tumors are more common as they get older. And then endocrine diseases, we will talk about that. Okay, so then quickly, some diseases of old age, and I'm going to go into a couple of these things. Cushing's disease, which we'll talk about. EMS, metabolic syndrome, we'll talk about. Colic, I have a quick little nugget on. Asthma. Horses that have never had asthma in their lives can often develop asthma as they get older. We don't really understand this, if it's a change where they get some fibrosis in their lower lungs and it kind of changes their physiology. Ophthalmic disease like cataracts and uveitis is also associated with aging. And then I put neurologic disease on there. Sidewinders, we don't know why horses become sidewinders. Have any of you seen a sidewinder? They literally walk with their butt in another zip code. So they'll walk at you straight and then their butt's just like off to the side. So that's why they get sidewinder. We don't know why they do that. Some of them respond to medication, some of them don't. We think it's primarily a local neurologic issue in their pelvis, but again, stay tuned. We don't know why. Okay, quick nugget on collative aged horses. Horses, as they get older, we just talked about local tumors that can happen. Intra-abdominal, or things happening in their abdomen, lipomas, so little fatty tumors. If you believe in intelligent design, I always joke that horses are the perfect counter argument, because why would you grow a tumor on a leash? So lipomas that happen in horses' abdomens, they literally grow, and they can be varying in size, like from the size of a quarter all the way up to the size of a grapefruit. And they come on these long stalks. And so what do you think happens when you have a wrecking ball floating through the abdomen? Right? Because they're horses, only the worst can happen. So they wrap around their small intestine, which is what this is anatomy teaching software on the right. What they do is they wrap around loops the small intestine, cut off the small intestine's blood supply, and then the loop dies because horses. The only way to fix these is surgically. You have to go into their abdomen, remove the dead small intestine, reconnect the ends, and then take the lipoma out. We'll also, I've had surgeons call me if I send a horse for colic surgery for a different problem. They'll call me and be like, we found 4 lipomas while we were in there. We took them out. I'm like, thanks. What an insurance policy. So the strangulating lipomas are more common, definitely in aged horses, and that's just because, again, that connective tissue. Impactions, large colon and cecal, enteroliths, displacement, and then neoplasia. So I had a kind of a weird case a couple months ago. We referred up to Equine Specialty Hospital. The horse had intestinal lymphoma, which, like, again, no other external signs other than he would get mildly colicky about every 2 to 3 weeks. And finally, we were like, there has to be a reason for this. So they took him to colic surgery and they found the lymphoma. So some of those weird little things just happen in older horses. A quick note on orthopedic disease, just because we could, again, talk about this all day long. We know degenerative joint disease, again, degenerative is going to get worse over time. One of the worst things that I probably see in older horses are horses with hind limb lamenesses. They get very weak behind, and when they go to lay down, they can really struggle with getting up. That is probably my least favorite emergency. It's always about 10:30 at night on a Saturday. Someone calls and says, my horse is down in the pasture and he can't get up. I'm like, oh God, because you know that these horses, the problem is once they start having trouble getting up, it can often be a thing where they will continue to have trouble getting up. And those horses can be pretty miserable when they get stuck down because they literally just can't get that gumption to push off the ground. So it's a little plug that if you have horses that struggle with hind limb lamenesses and they're older and you've noticed that maybe they're a little slower to get off the ground, talk to your veterinarian, because we have some strategies to help these guys. I would rather give you a plan than have to come see you when the horse is down and you can't get them up. We do have some support for chronic lamenesses that are not just joint injections. So a lot of people, and we don't want to use steroids in older horses, potentially with Cushing's disease. We have other things to use. So again, talk to your vet and they can help you come up with something that's a good plan for your horse. And then I think part of this that we used to talk about, sometimes lameness was a career-ending thing and that was just the end of it. But now, again, we give those horses other careers, and it's not necessarily something that's going to cause the horse's ultimate demise, but it certainly can affect their quality of life. So if you have a horse with a lameness issue that you're really struggling with, even if they're pasture sound, they're able to kind of get around, maybe not, you just kind of look the other way when they trot. If you're dealing with something that you feel like the horse's quality of life is decreasing, like just a plug to talk to your vet and kind of come up with a plan to manage those horses. Again, and I put this at the bottom, some types of lameness can lead to neurologic disease later on in life. So lower neck arthritis that horses can get, they can develop neurologic disease later on. And it's not always EPM. Okay, how's everyone doing? Good? Checking in. Great. Excellent. So we'll get into, I didn't put like 6 million slides on this, even though I probably could have. Endocrine diseases, Cushing's disease and equine metabolic syndrome, 2 different things, often related. They're like cousins. So Cushing's disease is a disease of the pituitary, which changes the horse's hormonal kind of regulatory system. And then metabolic syndrome, or some people will use just the term insulin dysregulation, is more of a metabolism, insulin, blood glucose, and fat problem. And not fat because the horses are fat. We don't fat shame. We just make recommendations. So first things first, Cushing's disease. The medical term for this is PPID, or pars pituitary intermedia syndrome, or dysfunction. It's essentially, what you need to know is that part of their pituitary gland no longer functions to create dopamine. And dopamine, you're like, well, that just makes the horses feel happy. What's the problem with that? Interestingly enough, as physiology goes, dopamine does a lot of things. So one of the things that it does when it goes away is the horses produce more of the hormone that we test for Cushing's if you have a blood test drawn, which is ACTH. And ACTH can actually contribute to the increased production of cortisol, which if any of you have ever had your cortisol tested, you know your doctor's cortisol messes with everything. It's kind of a bad guy when it's dysregulated in horses. So the symptoms of Cushing's disease, when I was a kid, they all just look like this. Like, I'm pretty sure you all could diagnose this horse with Cushing's disease. Now we are much better at catching some of these horses that are younger and perhaps showing some earlier signs so we can treat them earlier before you call me because their feet are on fire and they're not shedding their coat. So some of the earlier things that we'll see, horses that have excessive thirst and urination, the old horse that's like soaking a stall, that's a pretty easy one. Recurrent infections, so horses that have like recurrent kind of skin funk or foot abscesses, corneal infections, things like that. One of the ones that I think kind of shocks people is actually horses that have recurrent soft tissue injuries. So if I see a horse that like feels like every 6 months I'm like catching a bowed tendon or something, we'll actually test those horses for Cushing's because that can be a symptom of that disease. Some of the easy ones are the big hairy coats, right? Long guard hairs, so those thick, coarse hairs that grow out and are about 3 to 4 inches long. Legs, belly, throat latch. They get this lovely look of this. These are like, I have such a soft spot for the senior horses, but they look like this guy on the right. And then finally, metabolic syndrome. We talked about this, I think it was 2 years ago, we did endocrine diseases. Like upwards of 60% of horses with Cushing's disease will develop insulin resistance. So if you have a horse, I don't think she's here today. I have a client that had a horse that we screened her horse's insulin because the horse was a little bit on the thicker side. And the insulin was moderately elevated. She goes, well, I'm feeding her all the right things. She's in work. I don't really know what's going on. I said, well, let's test her for Cushing's. And she was positive for Cushing's. I would have never guessed. This horse had no other symptoms except for her insulin was mildly elevated. Put her on Percend, insulin became normal. And that's the only thing we changed. So I don't think she's here. At least if she is, she would yell because we were very proud of that one. But metabolic syndrome. So again, the kind of cousin to PPID. The biggest symptom of metabolic, it's not just the insulin, but that's what we focus on, right? Because that's the biggest consequence. We do not know why horses' feet have such a high sensitivity to insulin, but horses with metabolic disease, their insulin goes through the roof. They are the opposite of people. When you have diabetes, your insulin production stinks. Horses are like, my pancreas has got this, and they just make tons and tons and tons of insulin. And when their blood insulin increases, their body essentially goes, well, there's so much of this insulin floating around, we're just going to ignore it because it's clearly not telling us to do anything. And so their blood glucose can become kind of dysregulated. And so that then, when the insulin continues to climb because the blood glucose is no longer signaling appropriately, can create havoc. The biggest symptom outwardly is usually that the horses are obese, right? We can all pick that one out of the pasture. The like 20-year-old Morgan that looks like it's got a can of biscuits on its back, or the donkey that like its crest is like flopped over the side. Those are pretty easy. I have a solid population of horses that are a normal body condition whose insulin is 500-600. So you can't always rely on the chubbiness, but the thing that helps us diagnose it is the laminitis. What's unfortunate for us is that laminitis is very easy to diagnose, but very hard to fix. So by the time we get to my horse has raging laminitis, we're often like too late on the catching it, which we'll go into where we get into the preventative stuff. I do have a couple horses, and I put this in here as a little nugget, and I hope your veterinarians don't call me on Monday because you all call like, well, Dr. Johnson said. But I had a horse once who his only symptom was his sheath would swell up. He was mildly obese, like not terrible, but I always called him kind of a 6 out of 9 on the scale. But his sheath would like carry all this fluid. And I said, why don't we just test his insulin? That's easy. He's older and his insulin was super high. We managed his insulin and all that weird kind of body edema went away. Glucose is one of the things that helps control your body fluid regulation. So that's how I managed to explain that to her. It was kind of a weird case, but sometimes I do get that. Okay. On to nutrition. We're over halfway there. You guys are doing great. I haven't seen anyone sleeping yet, so thank you. When I talk about nutrition in senior horses, the way I typically kind of start this is most senior horses, what I take into consideration is what is their weight? What should their weight be? What is the condition of their teeth? And do they have any other underlying medical conditions? So as we talked about back in the dental section of this, the most important part of a horse's diet is forage, or, I kind of say fiber in the form of forage. So my humble opinion is that every horse's diet, excuse me, regardless of age, should start with a base of forage. From there, considering all those things I just mentioned, what do we have to do with that horse's diet to give them the ideal macronutrients and maintain their weight? There's kind of, and this is one of my favorite little nuggets, and I think most horse people have figured this out in the recent years. So now I don't seem as smart when I say this, but senior feed. A lot of people think senior feed. Well, senior horses are hard keepers, so the senior feed must be really rich feed. That's almost the exact opposite. Senior feed is majority fiber. It'd be like all of us here eating romaine lettuce. It's not very calorie dense, but it's a ton of fiber. So most of the feed companies have figured out this slide, which is that some horses need a fiber base, but some horses need not only the fiber, but a massive amount of calories. So that's what we were talking about in the beginning. Belinda had pulled some stuff out for us to use as a lovely backdrop, but Tribute, for example, it seems to be a popular one around here. They have their Seniority, which is just a very high fiber feed, and they have their Seniority Sport. So the difference in those things is they still both have that senior fiber base, but in the Sport, they put in a calorie supplement, usually a fat supplement, to boost the overall total calories per pound, so that those horses are not only getting the fiber that they need because their teeth can't maybe grind that hay up, but then they also are getting a calorie supplement to support their overall body condition. So I think that's really important if you're looking at feeding a senior horse. If you have a senior horse that's an ideal body condition, which I should just go through my slides because it's like I thought all this. Hold that thought for a second. When I am calculating dietary requirements for horses, this is what I use because I think most people are visual people and I think this helps. So I call it the church fundraiser technique. So I say if you've got this thermometer that is your horse's total daily intake, a horse that is in ideal body condition should intake 2% of their ideal body weight in forage per day. Notice 2% ideal body weight forage. So what that means is that a 1,000-pound horse, and I'm just using 1,000 pounds because easy math, should have about 20 pounds of forage per day. So that's our church fundraiser, okay? The next things, again, as I said, factors to consider. This forage is my base. Those of you that have senior horses know that this is a labor of love, because feeding these guys, especially if you have a horse that has really, really bad dentition and you're feeding them senior, you can't just throw 20 pounds of senior at them and say, have a great afternoon. You have to feed these horses 4 to 5 times a day. If you're using chopped hay, I don't know about any of you, haven't won the lottery lately, so I can't afford the $40 bag of safe starch when you're feeding about a bag every other day. So, if you're buying your own hay and chopping it yourself, let me tell you, that is not a fun experience. Anybody here chop their own hay? Yeah, how's your asthma? It's not fun. So I always tell people, I'm like, I have the easiest job in the world. I come in your barn, I tell you what to do, and then I leave. So I recognize, again, because I was the kid that at midnight was going out and making up the mush for our senior horses. I recognize it's not fun. So my conversation with people is usually, okay, how can we do this cost effectively, labor effectively, and heaven forbid you're in a boarding situation where good luck convincing them to come feed the horses 4 more times because we don't even have the people to clean the stalls, right? So I'm going to go over some things, and I want you all to know I am not completely head in the sand that this is not fun. So I recognize and I see your struggles. So I have a couple examples. We have example number 1, a healthy 1,000-pound horse with a body condition score. You guys all familiar with body condition scoring? Okay, so the scale is hopefully not 0, 1 to 9, 5 being ideal, 6 being on the heavier end of ideal. So this is a perfectly body condition scored horse. He has great teeth and is an easy keeper. Let's say that he does some light trail riding and not much else. So his church fundraiser is 20 pounds, 2% of 1,000 pounds. He is going to get 20 pounds of grass hay that his owner procures for him and feeds at a rate of about 3 flakes 3 times a day. And then because we live in Ohio, and sometimes, as we all know, our grass growing season is not the most ideal, and therefore we're concerned that our hay may not have all the vitamins and minerals in it, we're going to give him 2 pounds of insert your favorite brand of ration balancer here. So that horse is going to get his base of 20 pounds of hay, and then we're using the ration balancer to just fill in the things that might be missing nutrient-wise. This horse doesn't need a ton of calories. He's not a heavy worker, and he's a good body condition, so we're not trying to put weight on him. So this is ta-da, manage the horse you have. Easy. Then we get his neighbor. Horse number 2, 24 years old. He weighs 800 pounds, but Dr. Johnson said he should weigh 1,000. His body condition score is 3, so he's on obviously not only the lower end ideal, but we'd call him kind of skinny. I said he should be a 5 out of 9. And oh, by the way, we did his spring dental and he has horrible teeth. Nothing is touching. He can't grind anything. And oh, by the way, we've always kind of struggled to put weight on him. This is like probably 50% of the dentals that I do in a given day. So what we're going to do is, because this horse has bad teeth, we have to kind of skip parts of digestion for him. So this is where the church fundraiser mentality comes into play, which is I tell people, your thermometer is 20 pounds. I don't care how you fill it. So if you want to do 10 pounds, like in this example, I use 10 pounds. I call it a fortified senior, or like a senior sport, senior gold, Pro Force Senior, insert your brand here. And then 10 pounds of chopped alfalfa hay, or you can buy bag chopped alfalfa. You could even fill in, anything here. That's where this, I think, makes it easier for people, because some people, like, chopping 40 pounds of hay a day is not doable, but I can do, a feeding of 5 pounds of alfalfa pellets at night, and then I can chop probably 5 pounds of hay, and then I can buy 10 pounds of senior. But look at that, we're at 20 pounds. So that's where I say, I don't care how you fill this, just find a way to get to 20 pounds and feed the horse you have. And then same thing, because this horse has a lower body condition score, we're going to use the fortified senior so that horse is getting the extra calories to put the weight back on. A question?
Can you measure your alfalfa pellets or something? Do you measure dry or wet?
Dry. So she said, when you measure your, forage product, do you measure it dry or wet? Always dry. Yep. Good question. Thank you. You'll notice in this, I did not use the word soaked, which always is another hot topic. I personally recommend soaking any of the cubed or pelleted products. I have unchoked too many horses a year that have guzzled down some alfalfa pellets to ever trust them. I again recognize that it is not fun, especially in the winter we just had, and you're out there with your little tea kettle having a good time. But I do think it's worth saving you from the vet call, as much as I would love to see all of you again, preferably not in that situation. Now we have the third horse on the property, who's a 35-year-old, 800-pound horse, also a body condition of 3. He has no teeth left in his poor little head, and he also is a hard keeper. I did his dental, and I said, hey, some horses, and this is where it becomes really an individual situation. When I get into some mouths, I'm like, okay, this horse has like 50% of a grinding surface left. He can probably tolerate some hay. When I get these horses that have, I call them the river rock mouths, they look like a little landscaping yard in there. Those horses are not grinding anything. If they take a bite of hay in their mouth, and these are usually the ones that people say, well, I put a flake of hay in there so he thinks he has something, but he spits most of it out. I'm like, yeah, I get that, because again, I would be bored too if I couldn't graze like I had done for the last 34 years of my life. But at the same time, it's a risk, right? Because if that horse gets one of those quids into their esophagus just right and it gets stuck there, then you have to see me. And hay chokes are my least favorite. Grain I can usually break up and kind of push along. Hay, I got to pick that out like one little frond at a time. And then we talk about the weather and sports, which I don't watch. But, those are not fun. So I always tell people, again, risk and reward. These horses usually have to go what I call the mush diet. This is like Nana's retirement home diet, right? So for most of these guys, again, I'm using a fortified senior grain. And then in this instance, you'll see I overlapped. So this horse is getting more than 20 pounds, but he really needs to put some weight on. So I'm feeding excessively over that 2% to try to increase his total calories. So that 2% is not a hard and fast rule. For overly chubby horses, we'll use 1 to 1.5%. For overly skinny horses, we'll use 2.5 to 3%. So this horse, I'm feeding extra to try to get us there. And again, because he's got no grinding surface left whatsoever, he's on the mush diet, so we're soaking everything. Okay, this is always a hot topic amongst horse owners when I talk to them. What are we feeding these things and why? Grass hay, the biggest con to grass hay is, again, that if they can't chew it, it does nothing for them. So then that's where you have to go into what I call modified fiber. So cubes, pellets, chopped. Honestly, for me, it doesn't really matter. If you talk to some of the nutritionists, the things that they will kind of pick apart is that the pelleted forage specifically is the smallest particle size you can get, which means those horses spend very little time chewing. And you can talk about the physiology of chewing, and saliva production helps buffer and increase digestion. So that would be the argument for using like a chopped hay product, that they still have to kind of mimic chewing normally. Also, chopped hay for some horses that really have zero grinding surface, you have to get those pieces down quite small. In dairy cows, we have this down to a science, right? Because we care about their production. When I was in vet school, I said, I'm going to do food animal only because horses are my fun and I don't want to do this for a living. And here we are. But in dairy cows, we know that those pieces that you feed a dairy cow for maximum feed intake efficiency is 1 inch or smaller. So if you go on a dairy farm, they have these giant machines that they dump all their food into and it grinds it up. And those machines literally will grind it down to this perfect inch-long piece of fiber so that when they dump it in front of that cow and it eats that, they know they're getting their maximum digestion out of it because they have to do very little work by the time it hits their rumen and they can process all that feed. We don't have a number in horses for maximum feed efficiency, but I use the 1 inch. Fiber's fiber. Bacteria are bacteria. They all ferment the same for the most part. So I use that number in horses. And so to chop hay down to 1 inch is a labor, especially like, the way that in talking to horse owners and kind of coming up with some things, the way that I've found that's most accessible for people to do this is with like an electronic leaf mulch or a powered leaf mulcher. You've got to feed those flakes through there 2 to 3 times to get it down to this. And so about July, when it's 105 and you've been chopping hay for 3 years and the weed whipper's broken and the hay's in front of you and the dust is flying, it's just not fun. And I totally recognize that. And it's so hard. So that's where the pellets and cubes are nice. But again, now you talk about the soaking and all those things. So this is where it comes down to, like, I spend a lot of my time just like troubleshooting with people. Like, okay, what is accessible to you? What's cost effective to you, and then what can you actually feed this horse? And then because horses are horses, some of them won't eat things. Why do horses not like alfalfa pellets but they like cubes? Do you guys see that? We have horses in hospital, they will not eat alfalfa pellets, but you give them an alfalfa cube, they will lick that bowl clean. I'm like, what is it about this? I can't figure it out. People talk about maybe it's the processing or the binding agents they use, but I've tried every brand and it is repeatable. So if you solve that, let me know, because I've got some horses I'd like to refeed differently. But okay, last section. You guys have made it. You're doing great. And this is what everyone cares about, prevention strategies, right? How do we keep these guys thriving? So here I am having the time of my life, floating a horse on the top. And then on the bottom, this is a geriatric donkey that when I was working in New York, he choked and got aspiration pneumonia. So we were x-raying his chest here to check on him. He did fine. He left the hospital and was doing great. I don't put any sad stories in these presentations. And if I do, I lie. So prevention strategies. These are things that when I'm at my like spring wellness appointments, which are like my favorite appointments, like how's the winter been? How you doing? How's your horse? Things like that. These are what we talk about. So my biggest things are habits and routine. I try to beat this into people. Keep things the same. I recognize, like we were joking, that they change the feeds every 2. Ooh, there's a new feed that says it does this. I'm like, just feed the horse the same thing. Keeping stuff the same. Turnout routines as best you can. Watering routines, even up to trying to keep your humans that care for the horses similar, because you get to know those horses so well and you can catch stuff. Some of my best owners are the ones that call me and they say, I don't think I have a problem, but this is kind of weird. And you're like, yeah, that is kind of weird. I trust you guys implicitly. You know your horse is way better than I ever will. And my job is to try to pull the pieces together. So if you know your horse is the best, you're just helping me or helping your vet do their best job. So that comes into number 2, which is monitoring. Know your normals. If I send you all home with one thing, please train your horses to have their temperature taken. Know what your horse's normal temperature is. So, a normal horse, 99 to 101. Some of these guys sit in the 100s. Some of them sit in the 99s. I've had people call me and say, it was weird. My horse was a little slow to eat breakfast and his temperature was 100.6 today. And I was like, well, that's not, 100.6 is normal for a horse. But I'm like, okay. She's like, well, he's normally 99.2. And I'm like, well, it's still normal. And then the next day she calls me, she goes, he's 105 now. And I'm like, yes, that's abnormal. Thank you. So you can catch some of those things pretty easily. Establishing with your veterinarian, we have a lot of people that we trust to care for our horses. And like I said, my job is to take your information and tie it together in ways that help you care for your horse the best. And so sometimes that's changing like what you're feeding. Sometimes it's changing your care schedules. Sometimes it's saying, hey, my horse blows up every year we give it vaccines. Maybe this year we do something different. Like the simple things. That's why I came into this profession. I love just getting to know people and their animals. And so we want to help you develop the best strategies to care for the horses. And part of that is as they get older, how can we maintain them? And then last but not least, baseline monitoring, which we'll talk a little bit more about, and then aggressive treatment. That's where the term tolerance comes in. These older horses cannot rebound the same as the young ones. And so I think you have to be way more forward thinking with caring for them and making sure that you're addressing all of the secondary things that can come with some conditions they can get. This is my technician, Kiernan. I don't think she's in the back. Everyone say hi to Kiernan. She's going to kill me on Monday because she hates attention. So Kiernan is my ride or die. She keeps me in line, but she takes great care of the horses. And so we talk about her horse in particular as a senior horse that we manage some things on, and we talk about routine. Like, just give the horses the same routine. I'm a big fan of trying to keep their schedules fairly similar. Yeah, if you switch to night turnout in the summer, rock on. But I just mean, like, keeping their kind of cadence of life the same. That gets you to know what's normal for them. If you're feeding them weird mashes only when it's cold out and you're like, they didn't eat their mash today. I'm like, have you ever given them that before? No. Okay. Like, it's fine. Small changes for younger horses can really be big changes for older horses. Even simple stuff like your hay. If you get a new batch of hay in for older horses, even if it's just a change in that texture, if that horse has dentition changes, like that hay that's just a little bit coarser may actually be a big problem for them. So try if you can't. And I know, again, I'm saying all these things that sound great on paper but are hard to do. I recognize that. But acclimating to new friends and environments. These guys can't fend themselves off like they used to. Just saw a horse 2 days ago that they got a new young horse in the barn. They just brought it home from an auction. They turned it out with the herd, and it just pistol whipped 3 of the old horses. And same thing, I was like, hey, maybe that wasn't a good idea. Monitoring their eating habits, their daily water intake, manure output. What's their manure like? Everyone's like, don't you hate talking about poop? I'm like, no, I love talking about poop. What's your horse's poop like? Is it soft? Is it firm? Is it mountainous? Is it hard little rabbit turds? Because again, if I'm coming to see your horse for an impaction or a colic, I'm like, hey, is this normal that they have like almost like borderline diarrhea all over the stall? And you're like, no. I'm like, great, that's a helpful piece of information. And then finally, and again, I recognize that this is hard if you're in a boarding situation, but having people that are familiar with the horses. I have a lady that lives in Florida like most of the time out of the year, and she has a caretaker that takes care of the horses when she's gone, and her caretaker knows those horses better than anything. And same thing, she's like, I can tell the moment something's not right, and that's so helpful to me because then I can be more aggressive with helping take care of them. So get your people to know your horses too. Okay. Baseline monitoring and monitoring for the horses. Knowing their vitals and habits. Yes. Okay, the blood work stuff is where this comes in, I think, the most into play. So monitoring these older horses for endocrine conditions and then other conditions. We don't talk, luckily, I think evolution has weeded out a lot of bigger problems in horses. Like, we don't see a ton of cardiac disease. We don't see a ton of liver and kidney disease, but we do see it. So do you pull like routine, just kind of screening blood work on your horses? Do you check their ACTH and insulin levels? Remember, these things change. Insulin is very dynamic. It would change day to day. It would change hour to hour. So just because you've had a normal test once does not mean that horse is normal forever. I had an appointment last week where I was like, have you ever thought about testing your horses for Cushing's? Yeah, they don't have Cushing's. I'm like, now? 2 years ago, 10 years ago? She's like, well, we pulled the blood work like 6 years ago. I'm like, okay, well, you probably should check it again. So these things change, and we usually recommend checking them yearly, but certainly if you're seeing things that are making you think this might be a problem, we can recommend testing them in a different interval. The other thing is not all testing is created equal. So we have testing modalities that are more sensitive than others. They are more expensive, so I don't typically like recommend running to that testing right off the bat, but if you've tested your horse at their baseline, they're normal, then maybe if you're still seeing some of those symptoms, maybe you do need to move forward with the more advanced testing. So just kind of keeping that in the back of your mind. Fecal egg counts. Older horses are more prone to a higher parasite burden. One of the biggest symptoms of Cushing's disease is immune suppression. And part of that is the part of their immune system that deals with parasites. So if you have horses that have Cushing's, or if you have older horses, we recommend fecals once a year or in low shedders every other year. But checking that can certainly, if you have a horse that's struggling with body condition, he certainly doesn't need friends that are eating some of his calories. Okay, and treatments, again, tolerance. These horses are so much less tolerant, and whether it's due to their underlying medical conditions, again, I just said Cushing's causes immune suppression. These horses with Cushing's, when they get chokes, in my world, they're immediately on antibiotics because I've seen too many of them get sick afterwards because their bodies just can't tolerate it. horses that have bad colics that need medical management, I'm much quicker to recommend these guys get hospitalized, get IV fluids, like this poor horse on the right, because again, their body, just all of that cascade and that trickle down effect creates so many bigger problems for these guys. So I always recommend being a little bit more aggressive with them. Or again, if you're not, it's not like shaming people to be like, well, if you don't hospitalize your horse, but if you're monitoring them at home and you're identifying that things aren't going right, then I'm like, hey, we should intervene differently sooner. Knowing their baseline, again, I can't preach that enough, of just knowing what's normal for them so that you can catch these things. So you made it, the coup de grace. These guys are living just longer than ever, and every year, like yesterday I was at the lady's house that lives in Florida, and she said she has this mini horse who was on the poster, if you got the postcard. And she said to me, she goes, I always think that she still shouldn't be here. Well, it's a compliment because you take such great care of them. And that's so true. You guys are taking such great care of the horses that they are staying with us forever and ever. And that's great. And I think if you're aware of the things that you need to watch out for and you treat them appropriately, these horses can be productive well into their lives. And don't let anyone tell you age is just a number. Don't let anyone tell you that a 20-year-old horse can't do things. As long as you're managing them, sky's the limit. So I hope you guys all got something out of this. I know some of it's pretty common sense, but if anyone has any questions, I'll take a couple while we've got some time here. But thank you otherwise. I saw you first.
Lyme disease and ticks.
Lyme disease and ticks. What about it?
Well, horses living in pasture pretty much turn out. What's the incidence you see?
I think it's hard because Lyme disease, for a long time we still don't have a good test for it. So the blood test you pull is just a titer, meaning does your horse produce antibodies against the bacteria that cause Lyme? So it's hard. It gets blamed for a lot of things that I don't think are necessarily Lyme. And because Lyme is endemic in Ohio, meaning we see it in tick populations. If you test every horse in Northeast Ohio, most of them will be positive, but most of them are also non-symptomatic. So yeah, it's a hard test. So I always tell people when you have a test that's not a great test, the way to make it a better test is to have clinical signs. So if you have a horse that the test is positive but it doesn't have clinical signs, and to me that has a much lower predictive value, or essentially how positive is the positive. So for me, if you're pulling ticks off the horse but the horse is otherwise normal, then you can screen them. But I always give people a iron or salt with that, which is, what are you treating, the horse or the test? I think sometimes we treat the test.
Just trying to prevent.
Yeah, it's hard. There is no good prevention. Some people will use the Lyme vaccine for dogs off-label in horses, but there's no clinical research behind that. Yeah, good fly control. It doesn't work. Yeah, she asked about tick prevention. I find good fly spray, keeping your pastures mowed down. I've had people use the Seresto collars or the frontline collars for dogs and cats. You can put them on their pasterns. I've had people use the cattle fly control ear tags and braid them in the horse's tails because it's just a repellent. So yeah, unfortunately, I have some people that say I love Equispot, and then everyone else says, bleh, I still find ticks. Yeah.
EPM disease.
Yes.
Explain that.
EPM, she asked about EPM disease. So it's a protozoal infection, or a little single cell organism that's usually in horses, spread by opossums. That's kind of the dead end host. It can be spread by skunks too, but we blame opossums the most. And so same kind of story with the Lyme. The majority of the tests that we have are titer tests, meaning you're testing the horse's immune system to see if they've ever made antibodies against it. Most horses, it's endemic here in Ohio, so we will see horses with positive test results that are not neurologic. The more classical way of diagnosing it's always been one-sided muscle wasting and neurologic disease. Again, I think because we're kind of bad at diagnosing it, it gets blamed for a lot. And if you pull those horses' blood work and they're positive, same story. Are they positive with clinical signs, or are we just a positive test result but no clinical signs? So the most sensitive way to diagnose it is to do a spinal tap and test the spinal fluid. Because if they have blood circulating antibodies, it just means their immune system's done a good job of producing the cells that fight it off. But if the brain stem fluid has antibodies, and it's more sensitive for a positive result. Any specific prevention? Yeah. Keep the opossums out of your barn. Just move the horses in the house. Yeah, unfortunately too, if there's it's spread through the feces. So if you're on a well, which like we don't have any science of this, like no one has studied if the opossum poops on the ground above your well, does the EPM travel down through the dirt and into the well? We don't know. But if there's any contamination in the stalls or any contamination in the feed, they can still pick up the protozoa. We don't have a vaccination. We don't recommend just treating the horses because just like we're seeing with our dewormers, they can get resistant to the medication.
So is that a parasite?
Yes, technically. Parasite's just kind of a general term. Like my mother would consider me a parasite. So it's not really. Love you, Mom. She's the best. It's a protozoa, which is just a type of, like, you do talk about bacteria, which are these little cells. A protozoan is a single cell organism that in itself is a whole. So it's just a type. But yes, it's a parasite. Sorry, that was very in depth.
How often do you recommend deworming?
Yeah, deworming. Especially in older horses, I'm a big fan of fecal egg counts for all the reasons that we mentioned. Whereas these guys are more prone to having higher fecal egg counts. If horses are low shedders, we've actually, as a industry, way backed off on deworming these guys because we see the resistance. So if I have a horse that's a low or zero shedder and has no other at-risk factors, then we only deworm them twice a year, spring and fall.
And do you recommend like switching off and on brands, alternating?
So this is where your fecals can be really helpful because most commonly we see resistance to ivermectin. And so if you, let's say you have your spring vet appointment coming up in 2 weeks, and so you give your horse ivermectin today, you have your vet pull your fecal in 2 weeks. If they're zero or low, then you can assume that your product has worked for them, or they were zero to begin with, but you've just given them the spring product. If you, after the ivermectin, have a high egg burden, then you know that ivermectin is probably not working for that horse, at which point I will recommend switching them. The other reason that I do that is if I have horses, let's say, again, I'm just out for your spring wellness, and we take a fecal sample and I come back and they're a high shedder, then I'll say, use whatever product you have, and then let's come take another fecal and make sure that that worked for us. And if it didn't, then I'll talk about moving products. And typically once that population of worms that horse has then gets spread into the environment. So usually that's what's there. So if I test one horse and ivermectin didn't work for them, I'm like, everybody now gets Panicure, just because, again, if that horse has it, probably everybody does.
Okay.
Yep, no problem. Yes. Okay. Probably, hopefully.
One, he has drainage, lymph drainage in his sheet, and I've been told for the last 10 years there's nothing you can do about it.
Mm-hmm.
And you had said there's some treatments that can do something.
Potentially. One of the things that I'll test is their insulin status, because some horses that have high insulin, insulin tells glucose where to go. So when you have horses that are insulin dysregulated, the body starts ignoring insulin signaling, and so the blood glucose can kind of be variable. Glucose, when you talk about your blood system, there are multiple molecules that are circulating in your circulatory system that control where water goes. So if you have water, or if you have too much salt, let's say, but it's not salt, it's like BUN, glucose, proteins, all those things. If those are not well regulated in your bloodstream, your body's going to put water elsewhere. And that's what lymph drainage is. Part of that is cellular debris and all the gunk that your body makes, but it's also water. And so for some of those horses, the sheath, because it's gravity dependent, right? It's on the low side. I think you see it more often there. And so I will test their insulin just to make sure that's not contributing. But I will tell you that probably a lot of horses that have lymphedema in their sheath, it's not an insulin problem, because we do see that pretty commonly.
He's had it for over 10 years.
Yeah.
And I'm just keep asking on their wellness check.
Mm-hmm.
Is there anything they've come up with? Because I have to clean his sheet once a month.
Yeah.
Also, same horse, he's getting down and not getting up for a bit.
Okay.
I mean, sometimes he sits like a dog and he does.
Yes.
What can we do about that?
Yeah. So
He is 26 years old.
yeah. So she asked about her horse. When he gets down, he dog sits when he goes to get up. That to me is like a classical sign of hind end weakness, because we've all watched horses get up, right? What do? They stick their front legs out in front and they push off and then they stand. So all of that push off has to come from the back. In my experience, and I'm going to look at our old technician Elise back there, whose horse does the same thing. Those horses, oftentimes it's hock and stifle pain because they, either they have some low grade osteoarthritis or high grade, and they just can't really engage that, or it hurts too. So for some of my older horses, whatever I'm talking about orthopedic disease, whether it's a, Grand Prix jumper or a Western pleasure horse or a 26-year-old horse that we love dearly and does nothing maybe, I tell people there's like a range of things we can do, everything from medical management up to intensive intervention, right? So intensive intervention is going to be things like joint injections and all that stuff, which you certainly could do. You could inject joints to help improve their comfort. For some people, whether it's cost prohibitive or they don't want to, use certain products in older horses, there are supportive care products that I'll use very frequently, and we did this for Elise's. Would you mind if I shout you out now that we're already here? Great. Elise's horse has some mild changes in her stifle, so we use a product that, ironically, I'm wearing the vest for that the company gave me, but called Zycosan, which is an intramuscular injection. It's Pentosan is the drug, and it essentially decreases the production of inflammatory proteins in the joint itself. And so for some of those horses, that treatment alone is enough to improve their comfort. Like Elise's horse, I think we do it, twice a year? Is that where she's at? Oh, she says she can't recommend it enough. Every horse at the clinic has gotten Zycosan. When it got FDA approval, we were like, bah! Because it's great. Because a lot of these horses just need, you don't want to inject their joints. You don't want to give them bute every day. So how can we support them? And that's a great way to do that. Adequan. I don't have as much success with Adequan on that front. So that's why I really like the Zycosan for that. But then for some of those horses, we do use just pure medical management, bute or Equiox, just something to improve their daily level of comfort so that they're not getting stuck down. Because I find that that's a vicious cycle. They get down, they try to get up, they get sore, they get tired, they're down. They try to, and then you call me because they've been down for 3 hours and they can't stand.
I lightly trail ride him, and he's getting to where like going down a hill, it's very hard for him.
Yeah. And so in my experience of tying all that together, and again, this is not an official diagnosis, so don't quote me on this, but it's usually stifles because that's what they have to engage to go down. So that's where, like, either looking at medicating the stifle itself or using one of those support products to help just increase their baseline comfort can really help. That's the single metric we use for Elise's horse, is when she starts to struggle to get up, we know it's time for her Zycosan. And correct me if I'm wrong, she gets her doses and then that improves.
Is that a very expensive drug, or is it
So it's
something for the average Joe can afford it?
Yeah. In our pricing at our clinic, and if you go online, it's about $400 for the whole treatment. So it's one injection and it's based on weight. So it's one injection once a week for 4 weeks. And then you can repeat it, as often as you need to. They don't recommend, like, people do all sorts of weird stuff with Adequan. They give it like once a week or once a month. They don't recommend doing that with the Zycosan. They say do the full series. And then if you need it again in the future, the average horse gets about a year out of it, but for horses with more advanced pathology, sometimes 2 to 3 times a year, they may need the course repeated.
It's just getting harder to find a good horse.
It is. It's very hard.
I'm getting old too. So.
But this is the beautiful. You've tied together the whole talk. This is the whole point: is we have all these tools that you don't need to get a new horse. You can maintain the horse you have. It just needs a little help. So yeah, that's totally acceptable. Sounds great. Okay. I'll be here in the back. We go to Middlefield frequently. Yeah, no problem. Yes. Yeah, you. Mm-hmm.
About a month into it, she had happened to Helen's Day, just post.
Yep.
And then they have 24/7 turnout. Well, about a month into her stall rest, she stopped eating hay and stopped drinking water. She would eat her pellets. And then after a little while, she would eat her half hay.
Mm-hmm.
So I would dig through and I would figure out why that came out technically.
Mm-hmm.
Nothing was that bad.
Mm-hmm.
I just wondered if anybody else had ever
Yes. Tummy and their colon. Horses that you change their environment. So just to summarize for if you couldn't hear, she had a draft cross at Boda Tendon, was on stall rest for 6 months. 1 to 2 months into to the stall rest, stopped eating her hay and drinking water. It was just kind of eating the small pieces of hay. and still eating her grain. So a lot of times for those horses, when you drastically change their living, accommodations, they can get stress colitis or stress gastritis, where their body essentially says, "I don't want to eat; it hurts." And so they will sometimes. Usually, what I get. Sorry, am I like way up in your face? Sometimes what I get is those horses actually stop eating grain and they keep eating hay, probably because of the nutrient components. Grain is more dense, so it creates more gastric acid. But it often can be because they have inflammation then in their stomach or in their colon that changes the way they want to eat. So often I have a couple horses that'll do that. Like I have one horse that always, she has Cushing's and she bows a tendon about every 3 months. And same thing, we're always kind of shutting her down and then trying to get her back into work. And we have found that when she goes on that rest period, we have to medicate her for her tummy. Yeah, they'll get weirdly selective. So they may choose one thing over another. So it's not a perfect diagnosis either, but yeah, it's not uncommon. You're welcome. Come up to the front.
I have a 29-year-old
Uh-huh.
and I ride him almost every day.
Great.
For at least a half hour.
Mm-hmm.
And I'm getting a lot of pushback from people, other boarders at the barn, and friends who have horses saying, I should not be riding him. You should just be a pasture.
Tell them to shove it.
Thank you.
I'll use my grandmother lived until she was 102, which I always joke. My boss says that's great. You're going to be here forever. She always said it when you start dying. Yeah, I have zero problems with older horses doing exercise. The biggest thing for me is, are they at appropriate weight and are they sound? If the answer is yes and yes, ride them across the country.
He has some dental issues.
Sure. Guess what? He doesn't need his teeth to trot. Or gait in his example. Yeah. Yeah. Tell them that they wish their horses lived to 29 and could be ridden.
I'm riding him into my 100.
Say, Dr. Johnson said so. It's on a video. Yeah.
I plan on riding him into my 100th
Good.
birthday. So
Right on.
29 years to go.
Right on. With a bag of senior, you can do that. Yeah. No, I think it's antiquated, right? And I think we as humans have this weird anthropomorphism where, well, they're old. They should be. You wouldn't want your grandma work. It's like that's not how this works.
They're not even as old as my horses. They've all been put out to pasture.
Yeah. Well, and I tell myself this all the time, right? We have to take into consideration what people's goals are. Some people, and there's nothing wrong with this, they don't want to invest things into these perceivable problems, right? Like if a horse has a lameness and they're like, yes, we don't want to medicate it, we don't want to treat it, this horse is just going to be pasture sound and we'll give her great, awesome. But don't shame people for having horses that can still do things and be productive. Right on. You're welcome. My pleasure. I'm sassy, so send them my way. I have a lot of pent-up anger. Yes. Love it.
This winter, he didn't like the hay.
Mm-hmm.
And he would go out in his pasture, he would eat, the grass. They don't have hay out in the pasture.
Mm-hmm.
Drink the water out there, but when he came in, he wouldn't drink. He wouldn't eat the hay, only the shards. So I've got him on chopped forage, Purina Senior. I've got him for a stomach, I think it's Cox, that for a digestive aid. What else can I do for him? Because he's not picking up his weight. Granted, he's 34.
Yeah.
But he goes out every day, like maybe 4 hours, and I'm bored.
Yeah.
So
The older horses.
I avoid the owners.
I feel you. The older horses are kind of the bane of my existence because they have a horrible reputation of being picky. And like for whatever reason, they'll like eat for 3 weeks and then all of a sudden they're like, I am not touching this. And you're like, it's the same grain you've had for 20 years. They're like, I don't care. So what I actually find is one of a couple things. One, which grain did you say you were feeding?
Purina Senior.
Okay. They have a senior active, which is.
I had him on that. She took him off of it and said he should have the other.
Yes. So my
That's what I went through with.
my opinion would be to use the senior active because it's going to have the senior base, which is the forage that he needs to overcome his dental stuff, but it's going to have the calorie supplement. They also kind of did some rebranding, and word on the street is they were going to get rid of senior active, but they haven't yet, and they have senior Altium, or Altium Senior, which is similar. It's that nice high fiber base with a calorie supplement. The other thing is older horses, in my experience, they love fat, so omega-3s and 6s. So a lot of times I'll use the DAC oil that's on the end there. It's a flax oil as a supplement, and it's.
I don't want to keep feeding you all this.
I know. So that's where I go for density, right? Because your senior that you're feeding, that I assume it's that red bag, right? Yeah. That stuff is the senior active has double the calories per pound as that grain does. So that's where you need to go for density. Now, if you're struggling with his fiber, which if you're feeding chop forage, you're filling that in. That's where, again, church fundraiser style.
When I go out, I always fill up the container and put it in. And let him eat it. Well, before I go, I lunch in half hour.
See, 34. He's still working.
Half hour, half hour to almost an hour. I lunch every other day because I can't go out every day. He goes out and pasture about maybe 3-4 hours.
Yeah.
She cuts the grass and leaves the horses in the stall.
Yeah.
And then
well, and that was going to be the next thing I say is these guys always seem to do better. We all say, oh, the old horses get skinny in the winter. It's not because it's cold. It's because they lose the grass, right? Short, soft. So if he can get access to the pasture, that's great. But I would switch him to the active. The other grain that I have really good palatability with, it's also high calories, Triple Crown Senior Gold. That Triple Crown Senior Gold, like if anyone asks me, what weight grain should I put weight? All day, Triple Crown Senior Gold. It's probably my favorite grain on the market right now. Both of those. Well, remember, floating, not often the problem.
And then they found, a point that they missed last year.
It happens.
But then, he's kind of coming back with eating the hay.
Yeah.
She only puts like 2 flakes in the morning, and then when they bring them in.
Well, and the hard thing is if his teeth aren't in great condition, even if he eats the hay, he's probably not getting nutritional stuff from it. Yeah. Quitting.
He's quitting.
Yes, hay cigars.
They're small.
Yeah.
So that's when you were talking about the grass. I thought, oh my gosh.
Yeah.
What's going on out there?
Yeah. No,
I was looking around to see if he was doing it out there.
Oh yeah, and they usually don't with grass because it's soft and wet.
And she has the muzzles. She starts them like now. All up until fall.
For your horse?
Yeah, up until fall.
Why is she muzzling him?
I don't know. She had one that had laminitis.
Oh yes. Well, you don't have to muzzle them if they don't have.
So I said, hey, let him enjoy the last couple of years.
Yeah.
His dad lived to be 34.
Nice.
He turned 34. I figure he's got maybe 3 years left.
Sure. Or 16.
And I said, let him enjoy it. Just take the muzzle off.
Yeah.
She goes, okay.
Yeah, and if she's concerned, if you were concerned or if she was concerned, then I would just check his ACTH insulin. If those are normal, then I don't have a reason to muzzle him. Don't leave because I have a giveaway.
So don't worry about the grass and laminitis. That's what she grows into.
It's all risk aversion, right? I know. Okay, real quick. Belinda and I came up with this thing before we started. So here's the question. Okay. Have you guys ever been to a wedding where they do what couple's been together the longest? Okay, we're gonna do who has the oldest horse here. So let's start at let's say 25, because if you have a horse that's 25 or older, hands up, please. Oh no, just hands are good. Okay, 26, 27, 28, 29, 30. Your hand's not up. You have 34.
No.
Oh, you have 34. Sorry. Where's your hand? Okay, 31. 32, 33. Is 34 our oldest? 34 going once. Huh? Well, then where's your hands? Okay, 34 is our oldest. You have won a $50 Big D's gift card. Congratulations for having the oldest horse here. There you go. You can go get you some bags of Purina Senior Active. Yeah. Talk to Belinda. She'll take care of you at the desk. Yeah. You're welcome.